My father was a veteran, a World War II veteran, and he served in the Marine Corps. Actually was a survivor at Iwo Jima in World War II. I lost him in January. He was really sharp until that point. And I had to get involved with the VA over the last couple of years, just navigating his benefits. And when I went there, he actually, in his later years, he was a volunteer at the VA. It was something he did. He went and talked to the veterans, especially the Marines, who came back from Iraq or Afghanistan, and they really enjoyed his company. And then I would go with him, because I'd like to spend a great deal of time with him, and I would hear their stories, literally, and I would see the problems that were happening. At first, it was really about job training, getting a job. A lot of it had to do with mental health care. There was some, horrible physical issues, but he would go about twice a week. His rabbi got him to do it, to go visit the veterans. And they loved to see him. He'd tell the stories because he was very sharp. So he could tell them what was happening in World War II, and they would compare it to what was happening, and they just thought he was a rock star. So they both got something out of it. So I was able to at least see what was happening firsthand.
What were some of the stories that you heard from these Iraq, Afghanistan veterans?
Well, a lot of them, were complaining that they just had some definite issues in terms of mental health. The few that I saw, some of them had some really severe physical disabilities. I remember there was a gentleman who an IED went off and he was blind, which apparently I didn't know at the time. That is one of the conditions that happen a lot, which I was very surprised, blindness. You don't read about it very much. And there was some amputees there, and they would just tell of the problems. A lot of them were complimentary of the VA, especially when it came to physical injuries. But in mental health, they would always have some issues and problems. And then I knew of the addiction, opioids, oxycodones, but I knew that from my own work as a personal injury lawyer. So I knew the dangers of oxycodone. So when they would tell me this, I would definitely understand. In the beginning, there wasn't a lot of talk about medical marijuana and its benefits when I went in there. It was not really a discussion. It was just how we're going to wean myself off of this oxycodone, or I can't get any more of it. The doctors basically took me off of it cold turkey, and I don't know what to do. And then I remember some of them had indicated they would buy the drugs off the street to help self-medicate themselves. That I remember.
What were they telling you that marijuana was doing for them that the prescription drugs were not doing for them?
A lot of them said it was definitely a lot of pain relief. Some of them said nausea. I remember thinking, that it was helping them in that regard. It definitely had to do with pain, of course, nausea. And I knew that about nausea from, cancer patients. And they just said it was just beneficial. And by the way, it's when the doctor, I think oftentimes when the doctor stops prescribing the pain medication, that was accessible to them, not outside the prescription world. So there was something they could get, and they felt more comfortable with, say, marijuana than any other drug that would, heroin or anything else that would replicate the opioids. So I saw that there was a lot of use because it was, I think, more readily available, and they believed it to be safer.
Were you able to get any feedback from the VA or some of the physicians about their position on medical marijuana?
No. Rarely did I have discussions with any of the officials there, because I was there really in my capacity for my father, as a son, who was just visiting the Marines, who have been injured or in the hospital. Not necessarily an advocate, more or less just learning.
So you're hearing from a lot of these veterans that they're doing something that really is illegal.
Yeah.
With their access to marijuana.
Yes.
They know they're breaking the law, but it gives them relief. So what needs to be done?
Well, obviously, in terms of medical marijuana, if it can help the veterans, or anyone for that matter, but if it can help the veterans who've come home, fought a war on our behalf, some have given their limbs and their mental health, If it's beneficial and it won't have any or negative adverse consequences, we need to allow them to use it. I mean, it's silly to put them on what you described in your piece as a combat cocktail, which we know is only going to be problematic. It may get them addicted to these opioids. And then you have another problem because they're going to go out into the street and try to self-medicate on maybe even drugs that will be much more harmful than marijuana. So we got to get it from the Schedule 1, get it off the Schedule 1.
Tell us about Schedule 1. Why is that a bad thing?
Well, if you decriminalize it, for example, not decriminalize, but at least take it off the Schedule 1 where it's up there with heroin and cocaine, I think the doctors will be able to prescribe it. Especially in the VA, because it's a federal institution, so that they will be allowed to actually use it to help veterans. And I don't think anyone would disagree. And I was at I call it the symposium, or that meeting and I heard the stories of the parents of the sons who were lost, and they believed that a lot had to do with the medication that was being prescribed by the VA, because that was the only medication they could prescribe. They had to address some of the pain and discomfort, but it was actually doing, in some cases, more harm than good. So if we can avoid that story about a woman's loss of her son to suicide, and we know that they're committing suicide 20 a day, if we can prevent it with the use of medical marijuana, I say let's do it, by all means.
Why do you think there's been such resistance on Capitol Hill to taking marijuana off of Schedule 1?
Perception, maybe a combination of perception of what marijuana really is, and maybe number two, pharmaceutical companies rather not have it out there. People are still making money on opioids and pharmaceuticals. It's hard to say for sure. Maybe perhaps just a perception of marijuana, afraid, fear.
How easy or difficult do you think it will be politically to get marijuana off of Schedule 1?
I think it's going to be easier now than it has been in the past. People like you who write comprehensive pieces on some of the benefits and some of the myths or fictions about marijuana is going to help. You have to start educating the public to the benefits. I think by starting with the veterans, because we all agree, these people who have fought for us, who have sacrificed on our behalf, they're going to get the attention. So that's that otherwise other people probably would not, quite honestly. So I think it's great that you're giving the stories of our warriors who've come home, and we're just trying to help them as best we can. So I think that is going to be helpful. Their voices are going to hold more, have more impact than maybe others. And that's good. So that's what because we really want people to do is hear, listen and hear. And if the messenger has to be the veterans and people like you who help tell their story, then I think that's a good step in the right direction.
Do you see this as a partisan issue?
Less and less, because I think the one bipartisan issue that we have is our veterans. I think Republicans, Democrats, non-party affiliates, I think we all agree the men and women who serve need the best. And no one is going to be against that. So there's a good start. We all come together because we all agree, let's help the veterans. And by extension, if it can go to the civilian population, once we learn through the veterans or the VA, all the better.
Your opponent, Vern Buchanan, says we need more medical research before we go that route. What do you think?
I think he didn't hear the stories of the people who were at that symposium that you held the other day, and the fight of the families of these individuals who who went to war for us, come home and actually take their lives at 20 a day. And the stories are the same across the country. That's a study in and of itself. Let's at least see what we already know, the empirical information or data that's available to us, see the common thread, and start working towards a solution. So I would say to him, the research to some degree is already there.
One of the things that I've heard, we'll wrap this up, is that there are more than 60 bills or thereabouts circulating on Capitol Hill trying to address one aspect of access to marijuana or another without removing Schedule 1. Can we do can we give the veterans what they need without removing Schedule 1 from marijuana?
Well, it looks like Senator Nelson started to accomplish that with his bill. Apparently in every state that has legalized marijuana for medical purposes or recreational purposes, the VA can actually prescribe medical marijuana for their veterans that go there. Then you have, of course, the issue of people will have to go to different venues to get the treatment they need, depending on the state where they live. I think you referred to it, or someone did, as a medical refugee. But it's a step. And sometimes you got to take that first step. And then people start becoming less afraid. So I think that sometimes you got to go for the half loaf, if that's what it takes to get the whole thing. So that's why, and I think Senator Nelson has made that step in the bill that he has proposed.